Do you know that something as simple as a persistent cough or an unexplained change in your skin could be warning signs of cancer? A 42-year-old woman from the US who thought she was just dealing with everyday fatigue and minor aches ignored the symptoms like a new rash and sudden weight loss, chalking them up to her busy lifestyle. Unfortunately, these seemingly small signs were early indicators of cancer, which had advanced by the time she sought help. Her experience highlights why it's crucial not to overlook any unusual changes in your health. Stay with us to learn about 15 symptoms that could be crucial in catching cancer, early information that could make all the difference. Number 15, sudden weight loss. Weight-conscious women become happy with weight loss, but watch it if it is happening suddenly. Many girls attempt to shed pounds, but losing 10 pounds or more in a month without any weight loss plan or exercise can be alarming. Unexpected weight reduction may be an early sign of cancer, as cancer cells consume plenty of energy. Other causes may include an overactive thyroid. If you experience sudden weight loss, see a doctor to rule out any serious conditions, such as cancer. A comprehensive medical evaluation can assist in pinpointing the cause. Number 14. Chronic headaches. A sudden headache may be a warning sign. Though migraines are common, persistent headaches could possibly indicate a more severe condition, including a brain tumor. Consulting a doctor can help rule out severe problems. If headaches are followed by visible disturbances, nausea, or mental changes, contacting healthcare providers is necessary. In this case, you should keep a headache diary, which could help diagnose the pattern of headaches. Number 13, night sweats. Though night sweats may be associated with menopause, they can also be a symptom of cancer, such as lymphoma. If night sweats are accompanied by fever and weight loss, it is essential to see a physician. Keeping an eye on the signs and symptoms can be helpful in the analysis. Number 12, irregular periods. Menstrual irregularities such as heavy bleeding or unusual pain can signify some cancers. Fibroids, which are generally benign, can cause these symptoms. However, they can also indicate cervical cancer. Regular pelvic checks and Pap tests can assist in discovering these issues early. Spotting between periods, bleeding after sex, or excessively heavy periods are signs and symptoms that need medical evaluation. Early detection through regular screenings can save lives. Number 11, blood in the stool. Blood in the stool must never be ignored, as it can be a sign of colon cancer. In contrast, hemorrhoids are a common cause, but persistent blood in your bowel movements is concerning. It is important to visit the doctor in severe situations. Dark stools can indicate higher bleeding within the digestive tract, while bright red blood might suggest lower intestinal problems. You should have regular colonoscopies to detect and prevent this serious issue early. Number 10. Lymph node swelling. Swelling of lymph nodes in places like the neck and armpits can signal a serious infection or even cancer. If you notice lumps that persist for more than 2 weeks, you should seek medical advice. Lymph nodes are crucial to the immune system, and their swelling can indicate severe health issues. Enlarged nodes, which are in groups, non-gentle and have developed over time, are particularly concerning. A biopsy is probably required to determine the cause. Number 9. Chronic cough. A persistent cough lasting more than 2 weeks without other obvious signs and symptoms should be a signal of lung cancer or leukemia. Persistent coughing, especially if it includes blood, ought to be evaluated by a healthcare expert. If a cough does not improve with medication, it may indicate a serious underlying condition. If you are a smoker or have been exposed to environmental pollutants, the risk is higher and early screening is important. Number 8. Trouble swallowing. Chronic indigestion or trouble swallowing can be symptoms of stomach or esophageal cancer. While these signs can be caused by less serious conditions, if they persist, it's vital to consult a doctor for a thorough assessment. Persistent heartburn, feeling full after small meals, or difficulty swallowing indicate a blockage possibly caused by a tumor. If these signs are accompanied by weight loss or vomiting, immediately visit your healthcare provider. 7. Urinary issues. Frequent urinary infections or blood in the urine can indicate kidney issues. These could be symptoms of kidney or bladder cancer. Persistent issues need to be evaluated to prevent serious complications. Painful urination, frequent urges to go to the bathroom, or issues with urinating should not be ignored. Regular tests can help catch these signs and symptoms early. Number 6. Mouth sores. Continued sores or aches within the mouth, particularly for smokers or heavy drinkers, can be signs of mouth cancer. Regular self-tests can assist in detecting early changes. Red or white patches or sores that don't heal should be checked by a healthcare provider. These sores are painless and can become more severe if left untreated. Early detection relies heavily on oral hygiene and routine dental tests. Number 5. Severe fatigue. Extreme fatigue, which does not improve with rest, can be a sign of cancer. Cancer cells consume the body's nutrients, causing chronic fatigue. If you feel exhausted all the time, for no apparent reason, it is vital to seek advice from your doctor to check for underlying causes. Fatigue that affects your ability to carry out daily activities, especially accompanied by other symptoms, should not be ignored early. Number 4. Persistent pelvic pain. Pelvic pain that persists can appear as recurrent bloating, feeling full constantly, or trouble urinating. While these symptoms can be common around menstrual cycles, and persistent pain may indicate ovarian cancer. Urinary troubles such as frequent urination or feeling unable to empty the bladder should also be examined through a specialist. Regular gynecological tests can assist in early detection of such conditions. Number 3. Alterations in skin. Changes in freckles are often overlooked. While moles may be benign, any noticeable changes should be checked by a dermatologist. Bleeding moles or changes in skin pigmentation can indicate skin cancer. Early cancer detection, including identifying high-risk types of skin changes, can lead to early treatment. Number 2. Changes in breasts. Breast cancer remains a leading cause of cancer death among women. It's essential to be familiar with your breasts well and to look out for any unusual lumps, redness, or changes in skin texture. Any alteration in the appearance or shape of your nipples or unusual discharge should be checked by a specialist. Annual mammograms and ultrasounds can help detect breast cancer early, considerably improving the chances of a successful treatment. Self-tests are also a valuable tool for early detection. Number 1. Unexpected bleeding. Unusual bleeding, whether vaginal or rectal, is frequently often overlooked by women. Bleeding between periods or from the gastrointestinal, GI tract can be unsuitable for menstrual bleeding, especially when you have an irregular cycle. However, vaginal bleeding after menopause or gastrointestinal bleeding might indicate endometrial or colorectal cancer. Any unusual bleeding makes it necessary to consult with your doctor for appropriate screening and getting early treatment. This can prevent you from severe complications. Monitoring your cycle and any deviations from the norm can provide essential information for early diagnosis. It's essential to be aware of those signs and symptoms and not dismiss them as minor issues. Regular screenings play a crucial role in the early detection and treatment of cancer. Remember, your health should always come first. Stay informed, live vigilantly, and take action when needed. If you found this video useful, hit the like button and subscribe to the channel to get more informative content. Thanks for watching.